Today's interview with Dr. Kathleen Janel will change your gut and your life for good. Dr. Janel has practiced medicine for over 25 years and developed the GI Janel therapy. This is a root cause antibiotic free approach for IBS and SIBO and CFO recovery. A Bastyr graduate with a biochemistry background, her work bridges microbiome science and functional medicine. Her book, GI Janel, Permanent IBS SIBO Resolution, outlines her proven protocol for lasting gut health. So let's get into it. I cannot tell you how many people I've talked to who have done a laundry list of diets and supplements, and they are still so confused about their health, dealing with chronic fatigue, chronic pain, and chronic symptoms still. At Nutrition with Confidence, we do not believe in quick fixes. We help you bio-individualize your diet and lifestyle recommendations and walk you through a step-by-step process that helps you to rebuild your body and calm your nervous system through it. This helps you regain control of your health and build confidence in your ability to heal. If you're interested in finally getting to the roots of your chronic symptoms, schedule a free exploration call at nutritionwithconfidence.com. Awesome. Thank you so much, Dr. Janel, for joining us today. I would love for you to start out by telling your story, how you became the GI SIBO IBS specialist that you now are.
Sure. It's been a long time in the making. Mainly, I graduated in the mid-90s from naturopathic medical school. And at that time, I was actually struggling with some of the conditions and symptoms that my patients come to see me for now. And the main symptom I had was digestive bloating, right? Which is not going to, put you in the hospital tomorrow, but it certainly does interfere with your life plans. So my particular pattern was wake up in the morning, feel fine, flat stomach, good to go. And then right around noon, regardless of what I ate or didn't eat, even if I just had water, my stomach would bloat up and be really distended, uncomfortable, a lot of borborygmus, noisiness. And that would basically last for the rest of the day. And I couldn't find a way to get rid of it. Now, this is before SIBO. We didn't even have SIBO back then. There was one lab that was doing a test called bacterial, let's see, they call it BISO, bacterial intestinal overgrowth, right? So it was early stages. And I went for about 10 years like that. So through the course of my education, through my residency, and then into practice, and it's a little embarrassing to not know what to do. And of course, anything new that came along, I would try it. I did all of the, low fermentation diets, and I did all of the changes, elimination diets. We had less back then than we do now, obviously. And then took all of the antimicrobials and antifungals and, natural medicines, prescription medicines. Nothing touched it. And I think, one of the things that's the most discouraging emotionally and mentally about that is that you just want it to go away so badly.
Right.
That, every day was like, okay, this new thing is going to be the thing. It's going to happen. It's going to go away. And, I see that with my patient population too. So I was, a colleague of mine said, hey, you should talk to this compounding pharmacist up here in Seattle. And I talked to her and she told me about sulfur, the sulfur treatment. I don't know where she got it from. I could never find her again. I'm like, were you real? Who are you? But regardless, I mean, maybe someday she'll hear me talk and she'll be like, that was my idea. But I basically tried it on myself. And when she first told me about it, I thought it sounded pretty ridiculous. It's like a lot of doctors say to me at this point, like, what is that doing? Well, so I had to kind of work backwards. But the short story is I did the protocol that she recommended, which is what I give to my patients now. And I would, if I'm remembering correctly, because this is going back a couple of decades, but partway through my titration up or my early levels of the full dose, I woke up one morning and the day happened. The day happened that I've been waiting for a decade, where I got to, the afternoon time and I didn't have any bloating, and I never had it since. So that's a good, 20 plus years that I've had recovery from that. So that's when I started using it on my patients and sort of collecting data around their recovery. And then that morphed into, me seeing all of these people who have failed the standard treatments for IBS and SIBO and helping them get digestive symptom recovery.
Right. What what are the problems with the conventional treatments for IBS and SIBO?
I guess it depends on which ones you're talking about. Um, I think the herbal nutrient-based treatments, for some people, they can help, or at least help a bit. For some people, it's the answer, and I don't see anything wrong with using those types of treatments under the supervision of a trained person, right? So that
Mhm.
you don't get a toxic herb or something going for too long.
Mhm.
Um, when you get into the medications, that's where I really start to question if we're on the right track. And that's mainly because I'm seeing people who have had up to 12 courses of rifaximin, Xifaxan.
Right.
And then when that doesn't work, it gets teamed up with erythromycin or neomycin or metronidazole or maybe some azole antifungals. So these people, I think, are really not benefiting in the long run from all of that antimicrobial medication. And the sort of the tagline is that, rifaximin is safe because it's not systemic, and that's true. It doesn't cross over from the tube into our bodies. So that means our livers and our kidneys don't have to work to process it. But it is a broad spectrum antimicrobial that's recovered 97% in the stool. So it's going all the way through. And as a broad spectrum, it's going to kill anaerobic, aerobic, gram negative, gram positive, everybody
Mhm.
that's in there, right?
Mhm. Yeah.
And, interesting, I saw a case actually this week where, see, I think it's appropriate to use Xifaxan if someone has a diarrhea condition,
Mm.
right? Because that's what it's for. If you look up any of, like, on the Mayo Clinic or the Cleveland Clinic or any of the medical references, they'll give three listed labeled diagnoses, and it's IBS-D, it's traveler's D, diarrhea, and hepatic encephalopathy. Those are the three listed doses. It's not even listed off label to be used on any of those sites that I can find. That's a whole creation, right? It's sort of
Yeah.
sidebar creation. So for me, it makes sense because diarrhea conditions can respond to antibiotics, and it's a good one for that. So give it a try, give it a try. Do it once. But if the symptoms immediately come back, like they did this week with this person that I treated, and, she was so happy, right? Because she's like, when I was taking it, my diarrhea went away and I felt normal and I felt so good and everything was great. And then the 14 days were over and she stopped taking it and everything came back.
Yeah.
So for me, that means we didn't treat the cause,
Mhm.
right? We didn't
Right.
treat the cause. So for whatever reason, your body is still giving you the symptom that there's something it doesn't like. And here's a sidebar. I could talk forever. This is a sidebar on where my thought process is at right now. I'm really into the whole concept of the mucus,
Yes.
right? And the fact
Mhm.
that we have to have that mucus layer
Yeah.
protecting the cells from contacting the microbiome, because our
Mhm.
immune system doesn't know those are probiotics. It just knows they're bacteria, right? So
Mhm.
what if when you take Xifaxan, you knock down the populations enough, you never completely get rid of, we have to have something in there. So
Mhm.
we knock down the whatever the irritant population is enough so that it's not having direct contact if the mucus layer is damaged. And then as soon as we're off of it, you've got that contact again, right?
Yes.
And that
Yes.
could be one of the reasons why sulfur is important, because it literally is what's holding the mucus together.
Ah, interesting. So before we get into the importance of sulfur and this, your protocol, more specifics of the protocol, have you heard of we had Dr. Natasha Campbell McBride on the podcast, and she talks in her book about pleomorphism occurring with antibiotic usage. And what are your thoughts with that also interacting with these cases where there's correction during the usage of the antibiotic, but then afterwards, there can be changes to the microbiome. The types of bacteria that are evolving and growing after that are not the good ones that we want either.
I think that's reasonable to assume that that can be going on. I mean, if
Hmm.
you go in there with a broad spectrum, you're going to have a completely different microbiome at the end of that treatment, right?
Right.
Is it a good one? Well, for 25% of people, it is. For
Okay.
75% of people, it isn't,
Mm.
right?
That's
So
a
there's that.
huge percentage.
That really is. I mean, yeah. So, and that's why I say, sure, try it once, and collect your data from that and talk to your patients and understand, what their experience is. But don't keep on repeating it over and over again because they get that relief for 2 weeks or maybe 2 months and it all comes back. I think, as people who are interested in functional medicine, we are always trying to find the cause, not just ameliorate symptoms, especially temporarily, especially with something as complex as the microbiome.
Right. And so many of the symptoms people are going to for you then utilizing these treatments are abdominal pain, diarrhea, constipation, gas and bloating, GI symptoms. And I don't know. I mean, I've had a few clients actually have come to me where they've said that they weren't actually tested for SIBO and they were just put on these medications, the antibiotics. And then they worked for a period of time, but then they stopped. And so most of the people that come to me are like, where's the root of the problem, and how can we fix that first? So, what is the root of these symptoms, and what have you found with this? You've found root cause resolution with sulfur.
Mhm.
Tell us more about your protocol and how that can help people.
Okay, well, I'll caveat this by saying that a lot of what I'm talking about starts out as theoretical information, right? Especially because my experience was this worked, and then I was like, how? Why? What
Mhm.
is this? And so I've had to go back and sort of drive the research almost by searching for various qualities of sulfur and how it benefits us. So
Yes.
right off the top, I would say we quite likely do have a sulfur deficiency, right? And
Epidemic, like an epidemic for everybody, right?
correct,
Okay.
correct. And when I say that, right, like our main sulfur source is methionine, which is an amino acid, so that is animal based, the
Yes.
majority. So when I talk about sulfur deficiency, I'm talking about plant-based sulfurs, organosulfurs, and plants, which are
Mm.
different animals, right? That's not the same. It's not the same thing as a strict amino acid. So that's what I'm talking about when I refer to that. And, there's some work from Dr. Stephanie Senna of MIT on glyphosate and showing how the glyphosate impacts our microbiome. So that could be impacting our ability to actually change the plant-based sulfur into what we can then use, right?
Yeah, I just interviewed Dr. Stephanie Seneff last week, actually, on the podcast. So, yeah, connect us with her work. So, she's saying sulfur deficiency epidemic from glyphosate Roundup, right?
Yeah, that's her
Okay.
working theory. And I found like an addition to that, when I was trying to prepare a lecture, I found that if you look at some of the soil studies where they spray the glyphosate onto the plants, right? And for your listeners, glyphosate is Roundup. It's a chemical that blocks something called the shikimate pathway, which is in almost all organisms, but not in humans. And that's how the companies are able to market it, by saying it's not impacting humans because we don't have that pathway, but 50% of our microbiome does. right?
Huge.
So there is a big impact if you're not eating, and not everyone can eat foods that are non-GMO, right? So
Mhm.
the bigger story with the you try and break it down so it's really just very basic, right? GMO crops have a genetic splicing in them so that they resist the glyphosate. So that means that, let's say it's corn, you have a corn crop, you can spray as much glyphosate on there while it's growing during harvest, post harvest. It's never going to kill the corn, but it will kill everything around it,
Right.
right? Which, from a farming, well, I don't know, from a economic perspective, that's great, right? You got a
Right.
good crop, but what are we doing to the planet? And what they found in the soil studies were that the microbes that are responsible for cleaning up this glyphosate, because it's got to go somewhere, right? Those microbes are actually the sulfur oxidizing bacteria that make sulfur into the form sulfate that plants require to take up. So
Mm-hmm.
there's a knockdown right there.
Okay.
And there's some studies that are showing that farmers are want to add sulfur back into their soils because it's just not, it's not there in the same levels that it once was. So, so with the food and then with our microbiome, right?
Mm-hmm.
If the glyphosate is impacting 50% of our microbiome, that certainly opens up a lot of real estate for small intestinal bacterial overgrowth
Right.
there. And then what else you asked about were symptoms.
Mm-hmm.
So bloating is like the number one symptom that I started using this protocol for,
Mm-hmm.
my experience. And bloating is fermentation. That's the root cause, right?
Mm-hmm.
If we were sterile, if we had zero microbiome, we would not have bloating, we would not have gas because they're necessary. Like when you make bread, you add the sugar to the yeast and you get the carbon dioxide gas, or any other fermentation process. The fermentation is orchestrated by bacteria or yeast or both. So when we see someone with bloating in the GI, then we know that's happening. So then the next step is who's doing it, right?
Mm-hmm.
Who's doing it in there?
Mm-hmm.
And is it, in my intake, I want to know specifics from people. Where is it? Right? Because
Mm-hmm.
if it's in the upper GI and you're burping, that's an argument for small bacterial or small bacterial or fungal, sorry, fungal or bacterial overgrowth, right?
Yeah. Yeah.
Because I mean, it's 25 feet long. If it's fermenting in the distal ileum, chances are it's not going to make it all the way up there. It's more something that's more happening in the first part, right?
Yeah.
And then if people have more lower abdominal bloating, like pelvic sort of or below belly button and below, then I'm going to be thinking more of a large intestinal fermentation problem.
Mm.
And, have a little bit of resistance to embrace the idea of intestinal microbial overgrowth because that's literally what that system is. The large intestine, you
Yes.
can't really overgrow when there's no room to put any more bacteria in there.
Right.
So our old term was dysbiosis, right? So there's
Mm-hmm.
something off in it. And when you have a fungal or a yeast problem overgrowing in the large intestine, that's often associated with constipation. So you can kind of put those two things together and say, well, even if I can't get yeast coming out on a stool sample, because you've probably experienced that yourself, sometimes you're like, I know it's fungal, I
Mm-hmm.
know it, but you can't get it out in a sample because those guys like to embed themselves into the wall and
Yeah.
they might not come out.
Right.
So, sometimes you have to use this, put the symptoms together and say, my best analysis of this is what's going on for you. And do you want to test? Sure, we can do any tests you want. But for me, the treatment's going to be usually the same, at least to start with.
Right. And I'm always telling my clients there's so many different types of yeast and fungi that we can't always test for in those tests. So it is a a mapping of their experience, their stories, their life story, even,
Yeah.
and piecing those facts together to make the best assessment. And why then is sulfur so helpful for both the well, actually, you were starting to talk about the glyphosate impact to the types of bacteria in our gut.
Mhm.
Um, with SIBO, there's different types, right? There's methane dominant, there's hydrogen dominant, and then the hydrogen sulfide, and that's the one that I've heard you talk about. This almost this is a common theme on the podcast, is that we find this root cause theory that is saying, kind of like looking at the problem as part of the solution, right? And so your theory of using sulfur to treat hydrogen sulfur excess in the gut is it's almost a paradox. Like, why would that work?
Mhm.
And then, so I guess, can you get into like why does sulfur work for all of those different types of SIBO, or does it not work for the other types?
It seems to work for all of them. It
Awesome.
does. And that goes back again to Dr. Seneff, who believes that we all have a sulfur deficiency. It's the fourth most common mineral in our bodies, right? We have twice as much sulfur as magnesium, so very, very important. Doesn't get a lot of press. Um,
Yeah.
and one of her working theories is that the hydrogen sulfide SIBO is a compensation for that sulfur deficiency because it's not a great solution. But if we can make hydrogen sulfide gas, that gas can passively diffuse into the bloodstream. It doesn't even need a carrier, and it can go up to the brain. The brain can convert it into sulfate so it can start feeding into our sulfur cycles. So,
Amazing.
I mean, that makes sense to me, in the sense that if it's really that we're treating, among other things in terms of repair, but if it's really that we're treating, then we provide the body with what it needs. It can then downregulate hydrogen sulfide production, right? Because the microbiome's always talking to the body, like, what do you need now? What are you low on? What do you got too much of? That conversation is always happening with those microbes. And so then they can downregulate the hydrogen sulfide. Hydrogen and methane downstream from that can then clear up and things can go back to normal. And I
Hmm.
see that work the majority of times if we're focused on a bacterial fermentation. If we're focused on a fungal fermentation, then there might be some residual symptoms to go in and deal with stronger antifungal medications.
Awesome. Awesome. That's a really, I have more questions about that. But I've heard you say that the sulfur compound itself is antimicrobial in nature as well as antifungal in nature. So it kind of helps
Mhm.
with when there is overgrowth in the small intestine, it can be like shaving that down even more too.
Mhm.
But what about people with sulfur sensitivity? And is that really just also a symptom of deficiency?
Yes, and.
Okay.
So, for some people, when we're up regulating those sulfur cycles and they start spinning again, transsulfuration, methylation, PEP cycles, then there can be an acclimation for some people, right? And it might even trigger some hyperactivity of the mast cells, people getting headaches and insomnia at the higher doses. But so far, 100% of the time, I've seen that resolve if they stick with it. So, what I'll have my patients do is drop down. Let's say they're at 15 grams and they start to notice something like those symptoms, right? Then I'll say, drop down to your previous dose where you weren't having that. Hold that there for a couple of weeks and then go up in slower increments. And there's a point in time where the body clicks over and it's no longer causing those symptoms. And they're like, okay, it's that, I've adjusted to that. They can do their titration if they're not at the full dose already, and then go through with the protocol.
Awesome. So, what are the specifics of this protocol then? And I want to get into like who would be a candidate for it. Yeah.
Yeah, we'll start with the bloating, trapped gas, right? That's the number one issue. But as I've gone along in practice and treated more complex cases, I've been finding that it's working for other things too. So definitely people with trapped gas bloating, that would be my starting point, is to have them start with the titration. Now it depends on what I think I'm dealing with in the package on the other end of the line, right? Because there's some people who are just, you know, really strong, haven't been through a lot of antibiotic treatment, so they can do a pretty quick titration. And in that case, I would do typically, I'd start with the GI1 powder and do a half a teaspoon every 3 to 7 days increase. You're going to get up to 6 full teaspoons and then hold that for the 8 week period.
Okay.
With someone who's moderately sensitive, I'll go sort of midway. Maybe we'll start with an eighth or a quarter, and I'll want to check in with them more often, especially in the beginning, to say, okay, this is normal. This is a good sign. Because in traditional medicine, we're used to like, I have a headache, I take an ibuprofen, the headache goes away, it worked, right? This is not like that,
Mm-hmm.
right? Because it's more regenerative and we're dealing with such a complex ecosystem.
Mm-hmm.
So you can expect to have, well, die-off reactions of yeast is another big one, right? Where
Yes.
people are
Yeah.
getting that flu-like malaise, fatigue. I talked to somebody actually just this morning over in Eastern Washington, and she said that she was so tired, so tired, so tired for the first, let's see, this is 3 weeks in, for the first like 6 weeks. And then all of a sudden, her energy came back. And she's like, why is that? It's because you knocked down the population of those fungal species, and now they're no longer dragging you down with their nasty chemicals they're releasing. Right.
Right.
And so those are all encouraging symptoms, actually, I find, once
Mm-hmm.
you know what you're looking for,
Mm-hmm.
symptom wise. And so with the hypersensitive patients, the people who just, they react to everything because they've been doing this for so long
Yeah.
that they're just so sensitive to, and their list of foods is down to like, 3 or 4 different foods. And that also concerns me because I'm thinking, well, where's the nutrient value coming from, right?
Right. Yeah.
What else is happening with this long-term restrictive diet?
Yeah.
So I will have them start with just put a pinch of it in water
Mm-hmm.
and then either drink it all at once or drink it throughout the day and keep on doing pinch dose increases until you develop more of a tolerance. Don't expect your symptoms to have any impact from that, right? It's not likely not going to do anything, but we're just introducing that nutrient information slowly.
Mm-hmm. And oh, go on. Go on.
I was just going to go into like other, we talked about other things besides bloating,
Oh,
right?
yes. Yeah.
So,
Mm-hmm.
a couple of the big ones, constipation. And most of the doctors that I've been talking to that are using this treatment are saying, oh my gosh, the patients don't need as much magnesium anymore to keep their bowels moving if they need it at all.
That's
Um,
amazing.
It's great. And I'm thinking that has a lot to do with the elastic nature of the sulfur bond, right? And the fact that we're underneath the sulfur that's getting absorbed is able to go in there and create more elasticity. So we have better motility.
Awesome. Yeah. And is that related to collagen in some ways? Collagen synthesis. I mean, so much of our body is built of collagen. And how, how does sulfur connect with that lining of the gut, mucosal layer, and also collagen in our body?
Yeah, it's everything. I mean, the sulfur, the principles of the disulfide bond, which is two sulfurs joined together, is elasticity and stretch, right? And
Mm,
that is the main component in our bodies that's, excuse me, holding proteins together, right? That's where we get our three-dimensional structure because the other bonds that, fold the proteins up are very weak bonds and they're not as numerous. So sulfur is the main thing. And here's our friend gluten, right? The thing that makes when you're making bread and you get everything together and then you get it into the kneading stage, that stretchiness of the gluten, that's sulfur. Those are disulfide bonds acting, right? That's where it's coming from. So that's a good like visual representation for what's happening inside of our bodies with those sulfur connections. So that's what provides that, elasticity is we all see mucus, right? When you have a cold, you see what mucus is like. It's really gooey stuff, right?
Stretchy.
It holds
Yes.
together and yet it can expand and contract. So that's what's happening inside the gut lining as well. We've got, a form of that, and that's held together by sulfur. Um, and then in terms of collagen, collagen is, really proteins, right? That's why we're using it now for like protein for people and bone broths and that kind of thing. But without sulfur, you're just going to have floppy collagen. You're just going to have the collagen strands. It's the heparan sulfate that holds those collagens together. And when collagen is processed and it's hydrolyzed so that it's small enough to get into our bodies, the sulfur is removed.
Mm-hmm. Mm-hmm.
So unless someone has a really good, plant-based sulfur diet, or they're taking extra sulfur with the collagen, but if they're sulfur deficient, they're not going to be able to reform it.
I've
They're not-
always, yeah, I went through a phase in the functional medicine practice I worked at. We were giving everybody collagen. And then I started doing more research and realizing so much of it's the synthesis and utilization of that collagen is dependent on our gut bacteria and this,
Mhm.
these other molecules, nutrients that are most people are deficient in. So that makes a lot of sense. And people, there's this overlap with EDS and collagen disorders and people with leaky gut, nervous system disorders. They're really sensitive folk, but they can all be benefited from this sulfur compounds. And your product, the GI
One.
one, is what kind of sulfur? What's in that? What's so important about that product?
Well, it is methyl sulfonammethane, right?
Okay.
But the thing that is important to me is I know the quality, right? I know the quality, I know the third party testing, I know what people are taking when they're using that. And what I've done is I've combined it with some Althea marshmallow root, almost slippery elm, just little bits, right, for the sensitive people. So as they're going through their titration, they're actually increasing those things as well. It's pretty rare that people have sensitivities or allergies to those particular demulcent herbs. They're pretty benign. Every once in a while, you come across somebody who, doesn't want those. And then I also add in a little bit of acacia fiber for the same reason as a prebiotic,
Hmm.
so that as people are increasing their dose, they're increasing their dose of that prebiotic as well. So when they're done, that concept, especially if they're really limited in their, nutrient intake, that prebiotic nutrient won't be foreign to their bodies. So then we can start working on something that's probably right up your alley, which is, expanding the diet,
Yeah,
right? Getting people
absolutely.
into the nutrient-rich foods.
Oh, yeah. Always bringing in more and more. And you had mentioned the L-methionine amino acid that's also sulfur. I recommend a lot of collagen or not collagen, meat stock, which it has natural forms of collagen,
Mhm.
and it's a good source of L-methionine. Is that essential in doing this protocol? Like, what are some of the other foundational nutrients, I guess, and foods, lifestyle, diet, things that are part of this protocol?
I often keep people doing what they're doing until I get them asymptomatic because I don't
Okay.
want to have too many balls in the air. And most of the people that I talk to now have been doing these restrictive diets for years,
Hmm.
so they're not ready to go
Hmm.
out and hit the salad bar. I want them to eventually, but they're not ready at that point. So often I will wait until the end, until they're feeling better, the bloating's gone, things are moving regularly, they're feeling good, and then I'll start to help to reintroduce the prebiotic, the fermentable foods as prebiotics. And I always warn people, don't just think that now that you're better, you're going to be able to go out today and eat, a head of broccoli or whatever. You can't do that to your body because you don't have the right makeup inside to handle it. But you can cook it really well and introduce it gradually, have a little bit every day. Same thing with legumes, same thing with the allium family, the
Hmm.
onions and garlic. So just gradually introduce it to your body so that you're encouraging the growth of the alpha diversity in the
Yes.
microbiome.
Yes.
Right. So then you've got your food as medicine working
Hmm.
for you. And then the only outlier of those would be what I consider to be the group of inflammatory foods, those foods that a lot of people react to, wheat, dairy, eggs, soy, sugar. So with those ones, if someone hasn't been eating them, then I'll have them do an elimination challenge one by one with those foods.
Hmm.
Eat some, wait for 2 days. Make sure there's no delayed hypersensitivity reactions that you're missing. And if there's no reactions, nothing comes back, then reintroduce them into the diet again if you want to.
Okay, great. What about molybdenum? Is that necessary for some people to do beforehand or only for some people?
Yeah, there was somebody I talked to recently that started out their patients with 2 weeks of molybdenum dosing and then went to the GI1 powder, so to upregulate the sulfate oxidase. Okay, here's where we're going to go biochemically, and this came up with your question about methionine as well. Right?
Okay, cool.
So,
Hmm.
molybdenum comes into play after the methylation cycle when you're in the transsulfuration cycle. And what it's necessary is for the conversion of sulfite, which can be really irritating. I mean, some people have sulfite allergy, but in general, no one's going to really like sulfite in high levels in their body. So the molybdenum is the cofactor to move sulfite into the sulfate form.
Ah, got it.
Right.
Hmm.
And so in the sulfate form, it's benign, it's innocuous, and it's super important because every single ring structure in our body, phenylalanine, tyrosine, vitamin D, cholesterol, they have to be sulfated for transport. They're not water soluble unless they got a sulfate tagged on them. So we need that for transport of all of those ring structures. And then what'll happen is that the sulfate will transport them around. Any extra sulfate is going to get peed out, right? And that's why I say that we don't store sulfur like other minerals, right? Like
Mm.
calcium is stored in the bones. When we need some, we go get it. When we have too much, we pack it back in. So that's our storage for sulfur. Sorry, for calcium. For sulfur, there's no storage. It's constantly in flux,
Mm.
either transporting things around or moving into the other sulfur-based nutrients to do their job, like taurine and glutathione and NAC. And once they've done their job, it's gone, right?
Mm.
So we
Hmm.
need a constant influx and we're having a constant output. So
Yeah.
that's where the molybdenum comes in,
Mm.
is that movement from sulfite to sulfate. So that can be really helpful for some people. And it's probably a good, personally, I don't want to do a 2 weeks of molybdenum before they start because I just want them to get going.
Better. Hmm.
So I'll add that in if we need to afterwards, if it seems like, okay, this might help you.
Hmm.
Um, and you can only take a certain amount of molybdenum every day, right?
Yeah.
We got to be careful, right? It's like it's a trace mineral, so max 2000 micrograms,
Hmm. Yeah.
max. Otherwise, you're going to start throwing other things off balance. And for the most part, we can get that from our diet. Depends
Hmm.
on what you're eating, right?
Hmm. Hmm.
Methionine is the start point for the methylation cycle. So now we're talking about up above the transsulfuration cycle where you've got that sulfite moving to sulfate, you've got the methylation cycle, and the only feed into the methylation cycle is methionine only. And it's an essential amino acid, so we're not going to make it,
Super
right?
important. Hmm.
So it's got to come from those protein sources.
Mm. Good. That's awesome. So I'm curious if you've found in all of your cases and tracking so many people, if you've started to piece together, lab markers for blood markers that are cueing you to start to think of, sulfur deficiency, some common themes among clients that are outside of the digestive symptoms.
Yeah, it can be skin elasticity. It can also be hair growth, right? Because um, that's literally, when we're doing a perm or straightening our hair,
Mm,
what we're breaking is sulfur bonds, right?
mm,
The sulfur bonds are what gives structure to the hair.
wow.
And so what they do is, they'll put the hair in the shape they want it and then use the chemicals to break the sulfur bonds and then put the other chemicals on them once it's in the right shape to reform those sulfur bonds. And now it's permanent, right? It's a permanent treatment. Why we call them perms. So that's what's happening at that level. So sulfur is really important in basically any structure that needs to be flexible as well as strong, right?
Mm-hmm, mm-hmm.
So hair needs to have flexibility, but it needs to have strength. Our skin needs to have flexibility, but it needs to have strength. So it's directly proportional to the number of sulfur bonds. The more sulfur bonds there are in a tissue, the stronger it is. The less sulfur bonds in a tissue, the more elastic it is. So
I
if you look
see.
at like, eggs have a lot of sulfur. Why?
Mm,
Because the creation that's coming out of that egg is a bird of some sort, and they need to have a lot of sulfur to form their beaks, their feathers, their talons, right? So those are all sulfur based, but the beak obviously is going to have a lot of sulfur in it relative to the feathers to
right.
make it so strong.
Mm.
Um, and I think I got
I
off track.
Yeah, I'm thinking of other tissues that
Mm.
would go along this. Is it helpful for this actual structure of the gallbladder duct and that function of liver gallbladder stagnation? And it sounds like the more sulfur would be like hair, skin, and nails, like
Mhm.
those harder and bones even, or bones,
Not so much.
not
No,
bones. Okay.
that's more calcium.
Yeah. Okay. Uh, but I mean, it's interesting because there's sulfur, even if there's in the mucus, like where there's more elasticity or these other tissues that there's still sulfur. It's not like nothing does in our body doesn't have sulfur in it, right? It's pretty
Yeah,
much
and I
everything.
think you're mainly going to find that in the form of collagen or some kind of sulfur bond. That's in the similar family, like actin filaments, right? Actin filaments are one of the main things that create our cell-to-cell connections. Well, there's sulfur in there. It's not necessarily collagen, but there's sulfur in there.
Awesome.
An offshoot of similarity. When you brought up the liver, I'm thinking about sulfur is actually hepatoprotective. The methyl sulfonamethyl version is hepatoprotective.
Mm.
But when you think about people like, say, people that are diagnosed with gallbladder hyperkinesis, right?
Yeah.
I don't think that the sulfur is going to change that for them. And in fact, I've actually have a couple examples of that, where we've managed to get rid of the gas and bloating. We've managed to get rid of the constipation and the heartburn, but they still have a hyperkinetic gallbladder. So there's probably less options besides, removing the gallbladder if they want to at that point.
Mm-hmm. Yeah. What about for cases of IBD that and more severe leaky gut? Is the MSM hard on the gut lining at all at any point? Or is it not best to use this protocol in those cases?
I would say it depends. And here's what I do. Because this started happening where people with inflammatory bowel disease and with, those colitises that seem to have no origin, right? You're like, we've gone through everything. I don't know what is triggering this. And maybe they've seen many, many practitioners and tried many things. So I'll start them on the GI1 powder, but I'll only do 2.5 gram dose.
Okay, not
I'll
the
do a
high.
2 point, yeah, so I'll do a 2.5 gram dose for a week. then I'll have them increase to a 5 gram dose, and then we'll talk.
Mm.
And what I've been noticing is that the majority of people get benefit from that low dose. And there's some people that want to work up to the higher doses, but if you're already getting amelioration of symptoms or the symptoms are gone at that dose,
Mhm.
I don't want to push it, especially for inflammatory bowel disease, because you know as well as I do, once that gets set off, it's
Mhm.
really hard to stop,
Yes.
right?
Yeah.
So
Hmm.
gentle, gentle is the idea.
That's really helpful. And you were talking about the importance of sulfur for antifungal, for constipation, connection. What about with the loose stools and diarrhea? When someone's going through an episode of loose stools, does MSM stop that? Can it help, or should you not do it and wait?
Yeah, and that's basically the symptom picture of the colitis people, colitis and inflammatory bowel disease.
Mhm.
So it's
Mhm.
certainly worth a try.
Mhm.
And I was really cautious at first, but I started to get a lot more confident the more people were coming back and saying, I'm no longer having this urgent diarrhea. And I don't know if that's coming so much from an antimicrobial or antifungal effect of the powder. I think it's more the anti-inflammatory
Mm.
aspect, right? So, and maybe it's healing the gut mucus so that you're no longer having that contact that you don't want to have, right?
Right.
Because, one thing that, let me just think this through with you. Um, I'm wondering why drug companies don't focus on the gastrocolic reflex, right? Because we have this reflex that happens when the stomach dumps into the small intestine. A chemical messenger goes through the blood to the colon and says, let's start contracting. Let's get rid of a previous meal so there's room for this new stuff coming through.
Mhm.
And people who have urgent diarrhea symptoms, regardless of their diagnosis, almost always say, if I don't eat anything, I'm fine. As soon as I eat something and it hits the small intestine, I'm running to the bathroom. So I think it's actually that a
Mhm.
hyper reflex symptom, right? So,
Mm.
I don't. It's so that's not what the pathway that the one powder is working on. It's working more as an anti-inflammatory, but for more intractable cases, I think that would be a really great target for someone to explore and say, how do we dampen down this this normal reflux? Is there some kind of
Right.
some kind of way we can block the receptors, or we can,
Mm.
dampen down the release, or something that can decrease that for people, which to me would be hopefully a healthier way than just, using the biologics to shut everything off.
Hmm. That would make so much sense too for even those constipation people who don't get any urge at all. And it seems nervous system related. There's the hypersensitive people, but it does seem gut related too, to the bacteria that are present in that are causing inflammation. And I could see the inflammation negatively impacting that communication in both scenarios in chronic constipation with no urge and hyper response. It's like interesting how some people lean one way or the other.
Hmm.
My
That's
we
a really good point. I had never thought about it. Probably because I feel like, if someone's constipated, I know what I'm gonna do and it's gonna
right.
work. And so we're done with that. But
Yeah.
that's a really good point. It might also have something to do with that internal communication, that endocrine information, right? That's going through the bloodstream, not going through the tube,
Mm-hmm.
and
Mm-hmm.
communicating with the various parts of the digestive tract.
Yeah, because some of my clients, it's just immediate. It's so quick, some of their reactions. And that actually makes me think of some of our challenging clients can be the histamine clients, people with MCAS.
Mhm.
I don't mean to call them challenging. It is a tricky thing, but it's definitely doable. And there's actually a lot of fun and so much reward for them because they can improve with changing the gut microbiome and increasing the DAO production, calming the nervous system. So I'm curious if there's any contraindications with people having high histamine reactions to MSM in your product, or if it's really helpful. Yeah, what have you found?
Well, the methylsulfonamethyl in the GI1 powder is an antihistamine, right? We know that
Awesome.
it stabilizes mast cells.
Mhm.
I think, though, that for some people who are, just ready to be triggered by whatever comes in a large amount, when you get up to the higher levels, it can probably stimulate more mast cell degranulation. And that doesn't just mean histamine. I mean, there's literally hundreds of thousands of different chemicals that are released by mast cells.
Mm.
And so that might need to be managed for some people. And
Mhm.
luckily, if you're using the antihistamines that cross the blood-brain barrier and the symptom is insomnia, well, you've got a one-stop shop there because you can just manage it. You can just
Yeah.
manage it with antihistamines until their body has reached a point where it can process that nutrient information you're giving it. And then, like I said, almost always will click over and it's like, oh, those symptoms are gone. So I'm thinking that the repair aspect has been working in the background
Mm.
while you manage any kind of mast cell activation
Mhm.
or, histamine sensitivities. Because they
Awesome.
do, there's one guy who's a biochemist. He's over in New York City. He never answered my question, but he told he, I'm really like anyone who will talk to me about sulfur, forget about it. Like just sit down and we're gonna
Awesome.
we're not stopping until we have to. But he told a patient of mine that methylsulfonamethyl can convert into a usable source for the sulfate reducing bacteria. Well, I have a study that lists the substrates and the bacteria that use them in hydrogen sulfide production because he was saying that that was what she was reacting to. And I'm like, okay, well, if you're a biochemist, then show me the pathway because I can't find it,
Ah.
right? I
Mhm.
can see all of the substrates here that are being used by the hydrogen sulfide reducing bacteria. And, methylsulfonomethane isn't one of them. So how is it if you think that's what's happening, I'll be open-minded, then tell me how it's being converted into cysteine or methionine or sulfomucin or some of the estrogen base sulfates. Like, how is that happening? Because otherwise, you can't just give the body a new chemical, a food chemical is what I'm talking about, right? And suddenly it's going to be able to convert it into something it can use. That's a process that takes a long time if it ever happens.
Yeah, for genetic mutation to
Mhm.
occur with that would where that would occur. That yeah,
Mhm.
and he didn't respond to you.
Never responded to me.
No, darn it.
Because you know
Maybe
what?
they,
I am always learning, right? And
yes.
maybe we'll find out, hey, actually, it can't. This is not what's happening. But at least then I'll be able to go, okay, definitely this is not what's happening. But if someone who is an expert in biochemistry tells me, yes, this is happening, I want to know. I want to know the pathway. I
Hmm.
want to know why.
And that would just help with knowing when and when not to use it too. If someone had, it wouldn't happen obviously for everybody because so many other people are getting helped.
Yeah.
So what do you think about using the protocol and the parameters to use it with children and even infants? Especially, I've been seeing, and we need something to help some kids who are born into a home that is not super healthy with mold toxicity. And so these babies have fungal overgrowth that's chronic. And so I'm curious if that would be useful or effective.
Yeah, but you're just going to want to watch your dosing.
Mhm.
So interestingly enough, yesterday I had a conversation with a pediatric doctor in Los Angeles because he wants to start using the GI1 pattern in his practice with his patients. And I think that the number one problem he's going to run into is taste,
Ah, yes.
right? So we talked about what can you mix it with, and dosing levels. So we've got a no observed adverse effect level, NOAA level, and this is a European study of 1.5 grams per kilogram.
Okay.
Right.
Awesome.
So let's say a 20-kilogram child, 1.5. So you're definitely doing a lower dose for them than you would an adult. And understandably, you wouldn't really need to get up to adult dosing levels, right?
Mm-hmm.
But yeah, I think the problem comes in with how are you going to get those guys to take it because they tend to have very discerning palates.
Mm-hmm. Yes.
So, I go back to a story about someone who came in. I was in another building then, so it was definitely over a decade ago. And she did the protocol, came back to see me at the end of it. She was better, the bloating was gone, digestive symptoms were normalized. And then she told me that she was mixing it with chocolate syrup, right?
That's funny.
In order to take it to make it palatable, and it still worked. So definitely the higher doses and the antimicrobial antifungal effect is overriding the fact that she was using like, Hershey's sugar-based whatever, right?
Mm-hmm.
So if that's where you need to go with the pediatric population, that's where you need to go. We've had people doing it in smoothies, in puddings, in plant-based ice cream products,
Awesome.
in and even in syrups, like you can use a fruit syrup or something else just to get those little guys to take it, because
That's
otherwise their
great.
chances are it's going to be really bitter for them and they're likely
Mm-hmm.
going to say forget
Mm-hmm.
about it.
Mm-hmm.
And then same thing with the dosing, right? I mean, I basically gave him two PDFs of my pediatric dosing protocols, one for bloating symptoms where you have to get up to the higher doses to eradicate the species,
Okay.
because that's what the studies show, right? It's a high dose over a period of time that actually has the antimicrobial, antifungal effect. And
Mm.
then another protocol for people who are maybe dealing with other concerns where you think the problem is starting at the level of the gut. They don't necessarily have to have an eradication of species, but an increase in repair of the gut lining, of the mucus lining, and helping to create alpha diversity in the microbiome. So then their systemic symptoms can be improved.
Oh, that's wonderful. That's great. Especially, I guess I'm thinking too, I'm curious, can they do other lifestyle things at the same time as doing the protocol that increase their sulfur, like magnesium, Epsom salt baths? Um, or is, are you getting too much sulfur? Should you just focus on getting the protocol sulfur orally? And I'm thinking, especially with kids, that might be another way to get more sulfur in.
Hmm. Hmm. Yeah, I don't think you need both.
Okay. Hmm.
And if you're talking about non-digestive symptoms, then you can probably get it in through the skin with the Epsom salts.
Hmm.
And
Hmm.
that again has a benefit for, obviously calming them down so they can sleep better at nighttime. That's a great holistic treatment.
Right.
But if you're targeting an antimicrobial effect on the gut, that's not going to happen through the skin. You're not going to get the concentrations that you need localized in, within the tube of the gut to be able to impact the species that you want to eradicate.
Awesome. That's great. Tell us a few more of these amazing stories. Maybe walk us through one or two cases that has been really amazing, their process.
There's so many. Honestly, there's so many. And, that's one of the reasons why I wanted to get the word out about this treatment because I have such great success with it. And now having more and more people in their practices having great success with it. Um, yeah, so that's why I really wanted to talk about it in the first place and started writing my book and getting the supplements available to people. Um, so yeah, let's talk about how, no, I kind of don't want to talk about this guy because it gives people too much leeway to start with high doses. So I
Mm.
won't, but let's just say there was a guy who did really high doses and got relief after, like 40, 50 years of symptoms. Um, see if there's somebody in my practice as of this week. Oh yeah. Yeah, here's one. So this would be like a 70-year-old-ish woman who heard Dr. Ruscio, who's a SIBO, podcast guy,
Yep.
talk to Dr. Seebecker
Mhm.
after Dr. Seebecker had heard me talk about this protocol. And so they were talking about it and she heard this and she was like a lot of patients was like, I want to go to the source, let me find her. So she was what I would consider a moderately sensitive patient. And so we had some titration difficulties in the beginning. I think she was getting some of those die-off type reactions like the fatigue and the malaise. So we talked about how to slow down and just work through that. And the symptoms that she'd had initially were gas, bloating, and constipation, and just a lot of fatigue, right? And she'd seen a lot of specialists. Actually, I think she even talked to Dr. Jacoby over in Australia. So she's seen everybody and
Wow.
done all the protocols, right?
Yeah.
And then she heard about this, got in contact with us, and she actually never got up to the full dose. She was able to go, and that's not necessarily required, right? Because if you get up to half the full dose or three-quarters of the full dose and your symptoms are gone and they stay gone, then you've done what you need to do, with the concentration of the one powder, right? You've managed to eradicate those symptoms. I just want people to get their symptoms under control, gas, bloating, constipation, maintain that for 8 weeks and then titrate down.
Mm-hmm.
So I actually talked to her this morning and she's like, well, that is like, it's gone, gone. So she was able to go to Italy recently. She said she brought it with her. She was
Okay.
still doing the full treatment. And she was able to, like a lot of people, she was able to eat more extensively in
Mm-hmm.
Europe, right, with their
Mm-hmm.
dairies and their glutens.
Mm-hmm.
But she's maintained that since she came back and is just really happy. She's like, I feel like that's no longer a problem for me. And she said, I don't want to stop taking it. I'm like, you can continue, but you don't necessarily need to take the full dose, right? The therapeutic dose is really just that, so I'll keep people on a maintenance dose of 5 to 10 grams, for at least a year after they finish their protocol. And then going forward, it's really up to them.
Okay. That's awesome. I was just going to ask, like, how long is it safe to take it? Especially if someone, I want to talk about maybe a mold case if you've, been testing for mold and people are living
Mhm.
still in a moldy environment and wanting to combat being colonized by the spores in the
Mhm.
gut and then the sinuses, taking MSM. What would you do for that?
It would depend on the symptoms,
Mm-hmm.
first off. So if we're dealing with those classic bloating, gassy, abdominal pain, constipation, diarrhea symptoms, I would definitely get them started on the GI1 powder for sure. And then, ideally, like you want to get them out of the moldy environment.
Mm-hmm. Yeah, it's still
I mean,
critical.
it's so important.
Yeah.
It's so important. Um, and then if the moldy environment is them because they have ingested or breathed in a mold spore, then obviously that needs to be treated. And I really haven't, I mean, I think that the GI1 powder can help strengthen, so they're going to be better tolerating this treatment. Let me look up somebody because that just really brought somebody to mind.
Awesome. Yeah, that makes sense. Going back to the mucosal lining, which is that protective barrier of our gut, I often find people who've come to me who have done a lot of detoxes, things like that. And when we when we work with them, we are a lot of the foods we are recommending do help build that secretory IgA and the mucosal lining.
Hmm.
And so there, if there's mucosal collapse, the detox is just going to get reabsorbed, right? Even
Yeah,
it could be really hard on the gut and the rest of the body to do those detoxes over and over. So it makes sense to just even have a barrier, like a maintenance of MSM when you're going through a detox of any kind.
absolutely. Absolutely. Okay, so here's somebody who ended up being a mold case and she didn't even know it. And I want to actually, before I do that, let me just say that I found a study when I was prepping for a lecture. And what this study showed was it was immunocompromised patients. But, it's kind of a chicken and egg thing, right? Because the obviously fungal species are going to take advantage of immunocompromised patients, but how long has it been in there waiting to have that opportunity, right? So these
Right.
are autopsy studies where they autopsy the digestive system, and the molds they found inside of there were just numerous and widespread in terms of the different, not just your Aspergillus and Fusarium, a Stachybotrys, they were just really eclectic species. And so my thought process around that was, have they been just, did they ingest that years ago? You know, and then they had an organ transplant, or then they had something else, and it was able to take its opportunity to then grow. And how many of these things are we missing with
Yeah,
people walking around with latent mold spores just kind of, in the background because they can hang around for years, right?
absolutely.
In
Yeah.
their spore form, they're just like, we're fine. We're just going to wait until, things look good, and then we're going to proliferate,
Mm.
right? So when I say the chicken and the egg thing, I mean, is the immunocompromise furthered by the fact that there's this latent mold spore that, when it has the opportunity, can then go in and make immunosuppression worse, right?
Wow.
So,
That is amazing. We also, a few episodes ago, interviewed Mark Lintern, and I'm not sure if you're familiar with him. He's come out with the cell defense response theory of cancer. And so he's basically taken the metabolic theory of cancer and added to it that what's triggering this, the Warburg effect in cancer cells, is a fungal invasion. And that's very common in, you were talking about, these are immunosuppressed individuals. Oftentimes that's in cancer people, people who've dealt with cancer or
mm,
gone through cancer uh, treatments, things like that. So that just is so fascinating to me that there's so much fungal invasion that they're finding in these autopsies. And that makes
yeah,
me
I
think.
was so surprised too. And I'm like, why isn't everyone talking about this?
Mhm.
But, um, you know, they're so resilient. The fungal kingdom, I mean, we're sitting in rooms full of spores right now, right?
Yeah.
And that goes back to that whole like Beauchamp Pasteur argument, right? Is it the soil, or is it the protection, right? Our immune systems are protecting us right now. And
Yeah.
someone who's immunocompromised doesn't have that same kind of protection. So
Right.
they're going to be more vulnerable to colonization
Mm-hmm.
than somebody else would be, because they're around us all the time. And I think that kingdom is going to be, if we don't make it, I think that kingdom is going to make it. They're going to be fine without us.
I know.
And,
They're going to
you
take
know,
over the world.
they're going to take over, and they already are underneath all of our soils, right? Like
Yes.
that, when I don't know who his name is, but the scientist that studies the mycelium, and how all of
Yeah.
the forests are completely connected underground by fungal species. And
Right.
their, trees are communicating. They could be miles away from each other, but they're communicating through this underground network of mycelium from the fungal species.
Yes.
They're here. They're not going anywhere.
So,
Let's get into this.
yeah, tell us about this case.
Yeah, it's a good one. Okay, because she's so complicated. So let me just see. How old is she?
That's a compliment in the practitioner world. Just so anyone listening, if you're like, oh, I'm a complicated case, I don't know.
Oh,
I love complicated cases. That's why I got into nutrition because I love problem solving and puzzle pieces. So, anyways, just so everyone knows, complicated equals compliment.
that's a really good, that's very important to say thank you because yeah, I don't want to offend anybody.
I know.
I'm not.
Yeah, it's like practitioner to practitioner. It sounds different.
You're right. Absolutely. Okay, so this onset was with a MRSA infection, and that infection happened 5 years ago in 2020. So she was treated with antibiotics orally and topically, which you would, expect from MRSA, like that's life-threatening. And at the time, two-thirds, she said two-thirds of the surface area of her body were covered in MRSA because it spread. I guess she didn't get on it right away.
Mm.
And it took 2 years to heal. So that's when she started having GI symptoms. Her gas began, her pain began in her gut, and she started to seek out some answers, but didn't really get responses to treatments. And her history before that was that she had constipation dominance as a child. Um, and so it kind of had always had some GI things going on. She said she was eating a lot of soluble fiber, but still very constipated. Let's get into, she knew that dairy was a problem for her, which, is for a lot of people, right? And that could be lactose intolerance or a protein reaction. I think hers was lactose intolerant. Oh, no, I think hers was a protein reaction because it wasn't immediate, but it still gave her some of those similar lactose intolerance symptoms like noisy gassiness.
Mm.
Somewhere along the way, she got put on a PPI for reflux, a protein pump inhibitor, and that made everything worse. So she got really a lot of painful digestive symptoms after that. So on her own, she went ahead and explored a digestive enzyme mix with HCl, and this helped her. So she continued taking that. She got tested for SIBO. During the course of this, she was methane dominant SIBO, which kind of fits into the constipation picture.
Mhm.
And she was put on some SIBO, herbal treatments, nutrient treatments, and they seemed to help, but they just didn't get rid of her symptoms.
Mm.
She'd had an endoscopy, was diagnosed with Barrett's esophagitis. She'd had a colonoscopy, everything was normal there. She had a gastric emptying study, that was normal. She had a brain MRI, that was normal. Food intolerance. She'd had a gallbladder HIDA test, and that was normal. And okay, so that kind of brings us up to her visit with me, which was first visit was about a year ago. Okay. And so what we did, she had read my book. So she had already ordered the GI powder. She had started it, but she's like, I want your guidance. And she was already on the soft food diet that I use, which is kind of a modified FODMAP diet. I get people off the inflammatory foods, gluten, dairy, eggs, soy, sugar, unless they know that they can take them, they can eat them.
Mm.
And I just have them cook their foods really well. You
So
know,
helpful for the
yeah,
gut. So
yeah.
helpful.
Like it's already doing excessive amounts of work to extract nutrients. And, I think years ago, people would be like, but I'm eating a healthy diet, right? I'm eating raw vegetables and blah. And it's like, stop that right now.
Yes.
You can't,
Mm-mm.
eventually what we
Not
want
yet.
to get you back to that point, but you can't. So basically her diet was like rice, meat, and cooked vegetables. And she'd have the occasional glass of wine, which I said was fine for her to do. So she started doing her titration of the GI1 powder. And let's find a check-in from midway through because it looks like I erased her midway through stuff. So let me open up another one so I'm
Hmm.
being accurate here. Let's get an appointment from a couple of visits in.
Yeah, it's so helpful for people to see progress doesn't come right away, but
Mhm.
it's it's some subtle shifts can be noticed very and they actually feel really big, the subtle
Yeah.
shifts sometimes for people.
Yeah.
Yeah.
Sure. Just to know something is happening.
Hmm.
Okay, so this is where she was partway through. She said that, oh, I didn't do her initial symptoms. Sorry, let me do that. Onset, FOC. Okay, so prior to initiating the GI-1 treatment, she was taking a lot of magnesium, so she was moving her bowels. She was having flatulence, and she was having trapped gas in two areas, right? So upper GI trapped gas, maybe more of a SIBO-SIFO, and then she was having a distinct pocket of lower abdominal trapped gas. So again, more of a large intestinal symptom, whether it's bacterial or fungal or both. So as she got into partway into her titration, what she noticed was complete relief of the lower GI bloating symptoms. So that was gone, but she was
Amazing.
still having upper GI symptoms. They were less, but she was still having them, especially after eating
Mm.
her food. So I think it's reasonable to assume that she was still getting fermentation by something up there. Was it a fungal species? Was it a bacterial species or both? And that sort of persisted. So everything sort of cleared up except for that upper GI symptom. And now I'm going to hop ahead to the one that we were on. And this is where we kind of got moldy with her
Mm.
because I was like, wait a minute.
Mm.
Okay.
Hmm.
So what she said was she got herself up to then the full dose of the GI-1. She was doing the full 2 tablespoon dose, 30 grams a day. She was having regular bowel movements. She got to, get off of all of the magnesium and it was just working by itself. And now her only residual symptom was in the upper GI. It felt like a ball of air that got stuck there, and it was occurring 1 hour postprandial, so 1 hour after her meals, and there was pain associated with this, an aching pain.
Mm.
So it was all bloating, but aching pain was what she was noticing as a predominant symptom that was bothering her.
Hmm.
So that's when we said, okay, let's look to see if there's not something stronger that you need. And we did, that blood test to show the determine, differentiate colonization from an external mold source. And I'll tell you what, I've never seen such a high panel come back.
Wow.
It was almost everything.
Wow.
So we're like, you know what, we're going to have to use some antifungals, prescription antifungals. So we started with itraconazole,
Hmm.
and then she actually had a reaction to that after being on it for a while. So she broke out in a rash, and it's like, yeah, I've seen this before. You can't stop. You have to stop it. We can't take that.
Hmm.
So I moved her over to voriconazole. And she seemed to be tolerating that well. It does kind of freak out conventional medical practitioners when they see people taking these because, they're big guns.
Mm.
They're not going to hurt your microbiome per se, but they do
Right.
have some side effects. So you have to manage people, check their liver, make sure
Hmm.
that's all good. So her liver was fine with the voriconazole. And what she noticed happening is, and this isn't complete resolution yet, I usually do a 3 to 6 month course of these daily, right?
Yeah.
She's about halfway through. So that symptom of first of all, that ball of air that gets trapped, it was no longer happening after 1 hour. It's happening now after 3 hours. So that's a change for her that, I think is a positive change.
Hmm. Hmm.
And there's less of it. So it's kind of, she's deflating, right? The ball is deflating.
Mm.
And my vision of that is that, she's got one of those fungal spore species just trapped in that spot. It's super happy.
Yeah.
And so it's going to stay until we continue to eradicate it with the medication. She's still doing a maintenance dose of the GI-1 powder for strength, right? She likes to do 2 teaspoons, so that's good.
Hmm.
But the other part of that symptom is that the pain is gone.
Amazing. Wow.
right? So no more pain.
Mm-hmm.
We're still getting some of that fermentation happening. Now it's 3 hours postprandial, and it's getting less and less. And she's about halfway through that protocol. So, she wanted to talk to me because she's going in for surgery, knee replacement surgery, and what should she do with the medication during that time? And I was like, just go off of it. And in fact, that might not be a bad idea because sometimes pulsing the dose of an antifungal is
Mm-hmm.
good because then those guys will say, oh, you know, we were hiding in spore form where you can't get us, but it looks like we're no longer under attack. So we're going to let down our guard and we're going to go into proliferative form. And then they're more vulnerable when you go back with the medicine. So she's
Mm-hmm.
going to go off of it for her surgery. And I also, would rather her not put that on her surgical intake. So they'll be saying, okay, what
Mm-hmm.
is this doctor doing
Yeah.
with this? Because
Oh.
I mean, if it were a standard treatment, she would have done it by now.
Right. Yeah,
Right.
exactly. Well,
So
and
as
oh, go on. Sorry.
no, I was just going to say, as long as, we don't have to risk developing resistance, then I think she needs it.
Yeah. Yes. I've seen that in Dr. Neil Nathan and Jill Christo with the mold, breaking mold, kind of success stories do often need these heavy lifters of the antifungals for colonization, and it's really individual. So we're you got to work with a practitioner to find out what's going to be the best for you. Do you utilize I think Jill Krista talks about using certain antimicrobial herbs or antifungal herbs with certain prescription antifungals to help they're synergistic in some way. I don't know. She doesn't get into the the details, but do you do that? Do you find that you always have to go for the prescriptions and like the herbal antifungals aren't as effective?
I feel like most people have tried those things already by the time they see me, and they haven't done the job. So,
Yeah.
and these are strong medications. They're directed medications.
Mm-hmm.
But that's for mold, right? That's for things that are, mold is different than a yeast, right?
Mm-hmm.
And yeast don't necessarily release mycotoxins like mold, although I've had people tell me that candida can convert into more of a mold-like growth pattern, right?
Oh
Because
yeah.
yeasts are budding organisms, they bud off each other. And molds are filamentous, they grow differently. So it
Mm-hmm.
depends on the budding or filamentous forms where you can actually get them with different medications. And I had a patient in Germany a couple of weeks ago and wanted her to get nystatin. And we were sort of wringing our hands like, who's going to prescribe nystatin for you for 3 months, right? And then ask for another 3 months. And I told her, like there's some people, like I know in the UK, some of my patients have been able to direct order from India because most of it comes from India anyways, so they can actually get what they want themselves. And,
Yeah.
things like nystatin and amphotericin B for yeast. Actually, amphotericin B is antifungal as well, but they stay in the tube
Mm-hmm.
of the digestive system, so they're not hard on the body, and they're directed to where they need to go. She emailed me back and said on the portal, and she said, in Germany, you can get nystatin over the counter.
Oh,
And I was like, honey, we're in business.
oh
You
right.
know, here's what you need to ask for. Go get it. Here's how you take it.
Oh, so
Um,
helpful.
yeah, because, then she can just orchestrate her own treatment and I can help her along with that. And there's no, trying to get a functional doctor over in Europe who's going to help us with it,
Yeah.
if they
Yes.
will.
So important. I actually have a client, I might refer her to you. Her son needs some practitioner who has prescription understandings to really guide them. And they live in Italy. Are really hard to find someone to cooperate,
Mhm. Yeah, because, right.
collaborate.
Yeah, collaborate
Yeah.
for sure. I mean, like I said, it's if it was a treatment that was a normal standardized treatment, they would have had it already,
Mm-hmm. Yeah.
right? They would
It's,
have.
yeah, this kid was in the hospital and they kept saying it's asthma and they don't even look for um other possibilities, and she's done the my myco lab test and
Mhm.
skyrocket high on
Mhm.
IgE and IgG. So that's definitely been it's a component, it might not be the whole thing for them. And um, but they didn't even consider looking at a fungal
Mhm.
infection causing these
Yeah.
chronic respiratory symptoms. And so that leads me, I just have one more, hopefully short question for you about what are some other symptom improvements that could potentially come from this? Do you ever see hormonal balance, hormones balancing in menopausal women, or um, respiratory things improve, like chronic pain, other symptoms that might improve?
Pain, yes. The rest, no, not
Okay.
from what I've seen. I mean, and obviously my focus is GI, and I still have my little brick and mortar, practice. So I've pretty much seen all of the spectrum of disorders over the years. So I have more go-to, treatments for those kinds of things. Like aspartame is an amazing herb for lung regeneration for people with COPD and asthma, bronchial problems. So I would choose that over. Is my computer dying? No, I'm good. I
Okay.
would choose that. We just lost some light, so I thought it was me.
Oh,
Um, I would choose that over doing the GI1 powder for people with that. I do see people getting improvement in, more cosmetic things, skin, hair, and nails.
mm-hmm. Mm-hmm.
And then I do have another PDF that I give people when we're using it as an anti-inflammatory for pain. And I met a Canadian doctor at one of the conferences, one of the gastro AMP conferences, who came up to me and she's like, "This is crazy, but I'm doing the same thing, but I'm doing it for pain." And I don't think her dosing was
Amazing.
as high as mine, but she's like, "I'm going to actually knock up my dosing a little bit more." And, as an anti-inflammatory, it's really wonderful to either adjunct people's current medication treatment or be able to have them, come down a little bit off of the NSAIDs or other stronger treatments
Mm-hmm.
that can have side effects.
Amazing. That's so, so helpful. Well, thank you so much, Dr. Kathleen Janel. I know this is your full name, but I want people to know it because this has just been such a helpful interview for me, and hopefully a lot of listeners can start to utilize. They can go buy your book. You have your website. Why don't you share where people can find you and get the resources to get help?
Absolutely. It's gijanelle.com. Very simple. And that's where we have a consultation page. We have a physician page for people who I'm training and nutritionists who can
Awesome.
sign up, and then we can refer our
Great.
patients out to them because they're using, they've been trained to use my protocol.
Hmm.
And I have a ton of videos on that page that I'll link back to my YouTube channel. And I love answering questions. And I love when I don't know an answer to a question. So when somebody asks me that, on one of the social sites or somewhere else, then I usually will not sleep before I do the research because I want to know the answer. I want to know, is this actually factually true? Even if it's not directly related to my Sulfur protocol or my products, I want to sort of put that together in my head for people so I can use it then when I talk to other people and help them.
So wonderful. I love that. The curiosity that you bring, the calm, the confidence that, you felt it in your own experience, and you've been able to just refine this process and help so many other people. And that's another kind of theme that I think a lot of people who get to the other side of their healing journey have these qualities, these
Mhm.
characteristics. So thank you for sharing that and being a beacon of light for so many.
Absolutely. Thanks for having me.
Awesome.